Good afternoon, everyone, and welcome to this afternoon's general session. Please say hello to the CEO of the Heart Hospital of Baylor Plano, Mark Valentine, and the Vice President of Patient Care Services and CNO, Susan Motes.
Thank you. Hello, everyone. The Heart Hospital Baylor Plano is the first and only freestanding full-service hospital in the region dedicated solely to cardiovascular care. We opened in 2007 and have quickly become one of the top 10 heart hospitals in the country, recognized internationally for our quality outcomes. We are thrilled to welcome you to the Magnet Awards ceremony. This afternoon, our chance to focus on the outstanding and dedicated individuals whose contributions have made an indelible impact on patient outcomes around the world, and to joyfully recognize the hospitals and nurses who celebrate Magnet designation and redesignation this year.
And now for our first award. This award is really a reward for one of you overachievers who visited early registration on Tuesday. All the early registrants were entered into a drawing for a $200 Visa gift card. And the winner is Lisa Paris. Congratulations. Please pick up your gift card at the registrant desk after this session. And don't forget to spend it while you're here in Dallas. And now it is a pleasure to welcome our Plano neighbor from the Medical Center of Plano, CEO Charles Gressley, and the Senior Vice President and Chief Nursing Officer, Sandy Hare.
Thank you, Susan. The Medical Center of Plano is a full-service regional tertiary care hospital and a level 2 trauma center. It offers the most comprehensive level of neurological care in North Texas, including the distinction as the first designated comprehensive stroke center in Collin, Denton, and Dallas counties.
This afternoon, the fun begins. Not that this morning's session wasn't fun, but we hope you're really ready to celebrate because the session is filled with awards, prizes, and surprises, all leading up to the ceremonial designation and redesignation of Magnet Hospitals with all the pomp and circumstance that can be mustered. Oh, by the way, don't remember, no candy throwing. And now, please welcome once again ANCC's President, Dr. Michael Evans.
Welcome back. Now for our first award. The Her Royal Highness Princess Muna Al Hussein Award recognizes significant contributions to healthcare across borders and a dedication to nursing globally. This year's Princess Muna Award recipient could not be more deserving. In addition to her impeccable academic credentials in the United States, she's the director of the International Council of Nurses Leadership for Change program and the director and facilitator for the ICN Global Nursing Leadership Institute in Geneva, Switzerland. As a special surprise for our honoree, please watch this special message from the CEO of ICN, Dr. David Benton.
President Evans, ANCC board members, thank you for giving me the opportunity to say a few words. On behalf of the International Council of Nurses and on a personal level, I was delighted to receive your invite to this important event. I've worked with Stephanie for nearly 10 years, and every day has been a true pleasure. She has a ferocious appetite for work and an enormous passion for our profession. She is a great leader, a fabulous educator, and an outstanding ambassador, not only for global nursing, but also for the United States. She has been in more countries than I can mention, and met more heads of state and ministers of health than most of us will meet in several lifetimes. She is truly an extraordinary woman, and as anyone who knows her will tell you, great fun to be with. Stephanie, all the success for the future. I know your family will be so proud. Just know that ICN considers itself truly fortunate to have the benefit of your phenomenal skills. Best wishes to you for this fantastic and well-deserved award.
Ladies and gentlemen, please welcome this year's recipient of the Her Royal Highness Princess Muna Al Hussein Award, Dr. Stephanie Ferguson.
Thank you, Dr. Evans, for giving me the Her Royal Highness Princess Muna Al Hussein Award. To Her Royal Highness Princess Muna, thank you for coming to the United States of America to give me this magnificent award inspired by your global works, your vision, and mission. I am honored, humbled, and grateful. When I met Her Royal Highness Princess Muna in 2003 at the ICN conference in Geneva, I was drawn to her like a moth to a flame. The experience was magnetic. I said, God, if I can just work with her and be like her and help her make a difference for all the nurses and midwives and people in the world, all would be well with my soul in the end. She invited me to implement the ICN Leadership for Change program in Jordan. It is one of our best programs in the world. The rest of our friendship and journey moved forward. For me today, this is what I call a but God moment. I'm grateful. I would like to once again thank Dr. Evans, Linda Lewis, the entire ANCC Board of Directors, all the commissioners, and all the team and staff of ANCC. I love you. As well, Dr. Marla Weston, Dr. Deborah Hatmaker, Dr. Pam Cipriano, thank you. I am an American nurse, and I'm a proud member of the American Nurses Association and the American Academy of Nursing. And if you're not a member of the ANA, shame on you. Shame on you, you need to go join. A special thank you to my boss, David Benton, and President Dr. Judith Shamian. Love you, love you, love you, the ICN Board of Directors, and all the staff and member states. Thank you, David and Judith, for letting me serve you and directing your leadership portfolio for 16 million nurses worldwide. I would also like to recognize my other global partner that I have worked with for more than 18 years, the World Health Organization, and all its regional offices, leaders, and staff members. Dr. Fariba Al-Darazi is here from the WHO today with me and my family. She is the coordinator for health workforce development for the WHO in the regional office for the Eastern Mediterranean. I've had the pleasure of implementing the Leadership for Change program in 9 countries in her region. We have strengthened systems and reformed educational systems in many nations in her region. Thank you so much for all you and the WHO have done for me, and please share my thanks with Director General of the WHO, Dr. Margaret Chan, and also Director General of the Eastern Mediterranean region, Dr. Ella Wan. WHO has allowed me to provide leadership on global health matters, shape the health research agenda for nursing and midwifery, set norms and standards, articulate evidence-based policy options, provide technical support to countries, and monitor and assess health trends in every region of the WHO. I'm happy that my mother and my father, Margaret and Herman Ferguson, are here with me today to witness this great celebration. And along with them, my aunt and my uncle, Thomas and Barbara Haskins, and their daughter, and my cousin, Tina Haskins. What a great day. I am a magnet nurse just like you. Woo! I love Dr. Greta Stiles. We would not be here today if it was not for Dr. Greta Stiles and Maggie McClure. Let's just keep it real. I enjoyed my days with working with Dr. Stiles with her in my country and also at ICN because, as you know, she was the former president of ICN. So to all the magnet nurses in the room, all those who are striving to be magnet, all the health systems with the designation, all my friends attending the conference from more than 25 nations here today, I love you. Let's continue to innovate, involve, and inspire. Thank you.
Over there. Congratulations again, Stephanie. This year, it is my great honor and privilege to announce the President's Special Award. This is not given every year, presented to an individual who has had a major and enduring impact on our profession. And we are all so very pleased to have this honoree here to accept the award in person. Our award winner is one of the world's true nurse champions. She is considered the mother of nursing in her country. She has dedicated her life to elevating the role of women in the Middle East and establishing nursing as a profession. It is no coincidence that many of our first international magnet hospitals are located in that region of the world. Here are just a few of her accomplishments. Hundreds of nurses have graduated from the nursing school she helped found more than 40 years ago. Her nursing education fund helps Jordanian women from underserved areas enroll in nursing programs. And she has inspired innovative nursing research by encouraging evidence-based practice, a significant factor in all of our professional lives. She created and leads the Jordanian Nursing Council, which governs nursing regulation and reform and collaborates with the world's preeminent health organizations. By now, I'm sure you know who I'm talking about. Ladies and gentlemen, let us recognize this woman of accomplishment, Her Royal Highness, Princess Muna Al Hussein of Jordan.
Mr. President, I'm delighted to accept the President's Special Award. The honor fills me with renewed determination to do my utmost always with passion for what I see and feel for all of you and nursing. To all you nurses, God bless you all for all you do every day. Thank you.
Congratulations once again, Your Royal Highness, and thank you so much for being with us here today. Our next award this afternoon, the President's Award, recognizes exceptional leaders who have helped to advance the mission, vision, and strategic goals of the American Nurses Credentialing Center. I have the honor of personally selecting this recipient every year, and this year it didn't take me long to decide who to pick. This outstanding nurse leader is now the Senior Vice President, Chief Clinical Officer, and Chief Nurse of the O'Neill Center at Get Well Network. In this role, she drives the development of new technology for nursing practice, and she brings the voice of nursing to patient engagement. She is currently serving as chair of the Advocacy Committee of the Friends of the National Institute for Nursing Research and is an editorial advisor to the Journal of Nursing Administration and the Nursing Administration Quarterly as well. Oh, and by the way, she's the former director of the Magnet Recognition Program and the immediate past executive director of the American Nurses Credentialing Center. Ladies and gentlemen, this year I'm especially pleased to present the ANCC President's Award to our dear friend and colleague, Dr. Karen Drinkard.
Thank you so much, President Evans, and all of my friends and colleagues at ANCC. My time at ANCC was truly a highlight in my career, and it was just a joy to serve with you all. ANCC is great because of the vision, the strategy, the commitment to excellence, and the volunteers. I was just fortunate enough to be part of the evolution and growth for the 5 years that I was there. To President Evans, Michael, you are a role model, an authentic leader, and you were great to work with. We are so fortunate to have you as a leader in nursing. I entered the field of nursing at a time when unlimited opportunities were available to women. So it wasn't surprising that many people, including my own father, greeted my choice with skepticism. Nursing seemed so traditional, and becoming a nurse seemed unpopular in a time of limitless possibilities. But like many of you, I was really good at science and I loved being around people. It was a combination that made nursing the perfect career choice for me. I actually got to use the gifts that God gave me to make a difference every day, and no other career would do. Being a nurse fills you up in a way that's hard to explain sometimes. I also knew early in my career that I wanted to be in leadership and management. My mother says it's because I was always a little bit bossy as a child. And my sister affirmed that by buying me Tina Fey's book, Bossy Pants, for my birthday. Well, what can I say? What other profession allows you to be a clinician, a manager, a researcher, a teacher, an entrepreneur? When I think now about the opportunity I have at the O'Neill Center at Get Well Network to advance the science of patient and family engagement, link the work to technology, I'm just amazed that the profession of nursing has so much to offer us. The work you do every day, being there for so many people who are scared and vulnerable and sick and healing. Your work to help people become in charge of their care journey and engage in their health is really nothing short of inspirational. I am humbled by the work that nurses do. You have all chosen a lifetime of service. For that, I dedicate this President's Award to each of you. Whether you are a magnet nurse or on the magnet journey, you are always working to get to the next level. Excellence in clinical care is what Magnet is about, it's what ANCC is about, and it's what you are about. Thank you so much for your service, and thank you very much for this President's Award.
And now we come to ANCC's most prestigious honor and best kept secret, the Magnet Prize itself. Once again this year, the Magnet Prize is being sponsored by the Cerner Corporation in support of nursing innovations. Please welcome one of Magnet's most enthusiastic supporters, the Vice President for Nursing at Cerner Corporation, Dr. Roy Simpson.
Thank you, President Evans and Executive Director Lewis, distinguished guests, staff nurses of the global nursing workforce. On behalf of Cerner Corporation, sponsor of the Magnet Prize, for the 6th year, all the nurse executive team and our clinical leaders and practitioners are excited to step forward to share with you a little history of the success at Cerner in sponsorship of the Magnet Prize. Each year, we are afforded on-site to learn of the use of the Magnet Prize by the winning organization. We see stories that are truly those of an exemplar in the Magnet enterprise, starting with acknowledgement for Dr. McClure's work while she was president of the American Academy of Nursing, who originally sponsored the research. Accolades of honor were the first award winner. The second award winner there followed with advanced practice nurses at Pitt Memorial to demonstrate of telehealth practitioners and nurses' role and future from our last year's winners, Lehigh Valley Healthcare. Starting with a visit at Abington Healthcare, where it became a part of the daily rounding of patient engagement, began a new level in patients planning their own care with St. Joseph's Magnet site, where funding was provided, saw matching funds for the hire of a full-time advanced nurse practitioner in outreach. In teaching and in disenfranchised, in helping the poor, Bassett Hospital's outreach to the community aided those school nurse programs. And Poudre Healthcare gave us care across the continuum with APRNs driving case management and outcomes. And the Craig Institute was an emotional journey of Americans, veterans, and spinal cord injuries that stepped us up to the plate of thankfulness and mindfulness in our work as nurses in care with a new discipline in telephone interventions worldwide in time of critical crisis for patients' care provided and designed by nurses in telephony. Dr. Evans and Executive Director Lewis, we at Cerner believe in innovation, from our Chief Clinical Officer to our Vice Presidents and CNEs of divisions to nurse informaticians, 500+ strong, moving magnet forward. And this year, in January, we welcome our new customers and colleagues from Siemens Healthcare as our newest family member. As we grow, and so does Magnet grow, we plan to be here right beside you and all the winners as we move nurses to new heights and new trials of making nurses a part of the solution of healthcare dialogue of public policy. I am deeply honored to be a part of this exciting train of good deeds and kind work that our profession steps forward to deliver at the bedside each day in a way that is individual and touches each patient. We at Cerner want to be there to support the process, outcomes, and delivery of care around the globe, just as Magnet grows more and deeper in worldwide vision and blueprint for all to have the best of care in the world. We plan to be there with you as sponsors of this most prestigious of all cash purses in our entire profession. Thank you.
Thank you, Roy. As you know, hospitals and healthcare organizations that achieve the Magnet designation cannot sit back and rest on their laurels. Magnet is only the first step in a continuing pursuit of excellence. The annual Magnet Prize goes to a Magnet hospital that embodies this ongoing effort by creating and managing a transformational program that makes a difference for patients and nurses alike.
There is truly some amazing work taking place in Magnet organizations. This year, the wealth of innovation and inspiration has made it extremely challenging to award the Magnet Prize to just one hospital. So on such occasions, we award the Magnet Honors to recognize additional programs whose transformative efforts deserve special mention. This year, the Magnet Honors goes to Miami Children's Hospital, Miami, Florida, for their Humpty Dumpty Falls Prevention Program. Please congratulate Dr. Jackie Gonzalez, Senior Vice President, CNO, and Jennifer Cardo, Nursing Excellence and Magnet Program Manager. Now applaud. Woo!
You over here at Linda. And now for the Magnet Prize itself. Linda, when you spoke this morning about the importance of evidence-based practice in nursing, you were delivering a preamble to the inspiring work of this year's Magnet Prize winner. The nurses at our prize-winning institution are the mainstay of a unique program, leading the way in developing and promoting a rich culture of learning and evidence-based practice. Nurses are the reason the program is so successful. This year, the prize goes to a program that has been 25 years in the making and way, way ahead of its time. A program that has turned its creators into national and international leaders for adopting and translating evidence into practice. It led to the development of programs and a guidebook used by thousands of nurses in the U.S. and abroad, in a variety of care settings, including acute care, home health, and long-term care. A unique strength of their program is its applicability, offering practical steps for teams working through the complex EBP process. Their statistically proven, positive outcomes for patients, families, and clinical practitioners are simply outstanding. The story of how they created this program is fascinating, and we're going to leave it to the Magnet Prize winners to tell you in their own words about their journey. Please join us in congratulating this year's Magnet Prize recipients, the creators of the renowned Iowa model from Iowa City, Iowa, the University of Iowa Hospitals and Clinics.